Welcome to our Conversations podcast, where we discuss personal, career, entrepreneur, and business growth with guests who are an expert in their field. We continue to focus on personal growth, specifically physical health and wellness. When it comes to our physical health and well-being, it's important to be proactive in taking care of it in order to enjoy fulfillment and balance in every area of our lives. It's also important to get the professional rehabilitative care that we need if things take an unexpected turn and we're not at our optimal level of health. Today, we're honored to have Courtney Ravell join us as our guest to give us more insight on this important area of our lives and to share her wisdom and experience as a physiotherapist. Courtney attained her Bachelor of Science or BSc degree in physiotherapy from the University of Cape Town. She specializes specifically in neurological and general physiotherapy. She has a significant amount of experience in her field, having worked as a physiotherapist at both Tshwane Rehabilitation Hospital and MH&P Rehab. Today, Courtney runs her own practice named Courtney Ravell Physiotherapy, where she specializes in providing home-based care in Cape Town, South Africa. Other interesting facts about Courtney is that she's a professionally trained dancer. Her and her husband are both avid CrossFitters and spend many hours keeping fit together. And she has a beautiful and very active puppy dog named Atlas. Welcome to the show, Courtney.
Thank you so much for having me. Thank you for having me as a guest.
Tell us a little bit about your journey to becoming a physiotherapist. What actually made you decide on making it your career path?
So I always made my study choices based on what I took a natural interest in and I found myself to naturally thrive or be good at. It was kind of a natural progression, I guess, after high school that it was I needed to study and I wasn't quite sure what that was going to be. So initially I took an interest to dance movement therapy, but because that wasn't accessible in South Africa, I started investigating what else would be in line with my interest of the brain, the body, the mind. And I consulted with some of my mentors at the time, which were mainly my dance teachers. And they kind of suggested that I look into physiotherapy. And after looking into physiotherapy, I thought this is definitely something that fulfills my interests. Then naturally, I feel I should excel. And that's how I kind of went ahead with studying physiotherapy.
Such an interesting journey, and you must have had some great mentors to actually take you down that path and encourage you to pursue it. Many of us as lay people don't understand or we misunderstand what physiotherapy is about. So please, can you help us to understand what exactly physiotherapy is and how exactly it can help us?
So physiotherapy is a medical profession. And physiotherapists are concerned with addressing functional or movement limitations that affect our clients' quality of life. We treat impairments that limit our clients from reaching their functional goals, and this can look very different depending on the condition being treated as well as the goals of the client. So, for example, physiotherapy for an elderly person who has perhaps had a stroke and has the goal of being able to walk within a home and carry a mug of coffee would look very different from, let's say, a younger sports person who has had maybe a hamstring strain and needs to rehab that to be able to return to sport. So the impairments would be different. Somebody with a stroke, more neurological impairment, whereas somebody with a sports injury, more muscular impairment. So we would treat it differently, but also their goals are different, and that's how rehab would look different. There are various types of physiotherapists. So I'm going to talk a little bit about each just to give a better idea. Often the respiratory physiotherapists are found in the hospital doing chest physio. This was commonly seen in the COVID pandemic. If you've come across physio for COVID, it's not only a respiratory physio that COVID patients tended to need, but this was very common. So treating the chest, helping to clear secretions, helping with breathing patterns and improving breathlessness and lung volume and that kind of thing. Neurological physiotherapy focuses more on injury to the neurological system, which is the brain, the spinal cord, and the nerves. So typical neurological conditions would be your strokes, your traumatic brain injuries, some autoimmune diseases like Guillain-Barré syndrome. Your musculoskeletal and or sport physios deal with the musculoskeletal system. So that's bones and your soft tissue as well as your nervous system to a degree because it all works together. I mean, your nervous system directs how your muscles contract as well as your ligaments and your tendons. Musculoskeletal therapists will focus on. Your orthopedic physiotherapists generally deal with fractures, amputations, any injury to the bone itself. pediatric physios are your physios that work with children. And then your women health physios generally work with women who are pregnant or just after pregnancy. And then you also have your palliative or end-of-life care physios who are not necessarily looking to improve quality of life physically, but helping people sort of leave the world as comfortably as possible. So there's a very, very broad field of where physios can treat, and we also work in very different settings. The setting typically signifies the stage of rehab that the patient or the client is at. Your physios, like me, do home-based care, but essentially that is care in any environment that's most applicable to where the client is struggling. So it's home-based care, but it can be in a mall if somebody is struggling with walking the distance of their particular mall or navigating the parking lot or the exterior terrain of that particular mall that they attend. It could be the sport field. It could be a church. It could be any setting that the person is finding difficulty with movement in. And we kind of look at that setting and then work on that physical goal, depending on the condition, of course. And then you'll also find physios in schools, in old age homes, many, many different settings that physios work in. And very importantly, physiotherapists form part of the overall healthcare team of that client. We work alongside the doctor. We work alongside the psychologist, the psychiatrist, if applicable. We work alongside the specialist or the surgeon. We work alongside the occupational therapist or the speech therapist, if applicable. So we really do form part of a team, and we really value good communication amongst the team in providing holistic care for our clients.
Sure, that is such a great explanation of how all-encompassing physiotherapy is as a profession. And as in many professions, Courtney, you've probably come across some untruths and things that we tell ourselves in terms of our physical health and wellness. So what are some of the myths that you would want to debunk for us?
Yeah, thank you for asking this question. So one of the myths that I'd love to debunk is that you need to either present to a doctor or first go for a scan before you see a physio. What we need to be very careful of when going for scans, x-rays and MRIs is that it is part of the full clinical picture. It's not a diagnostic tool on its own. Oftentimes, it's very common in the population for persons to have pathology that will show on a scan within their shoulder, within their spine, or their lower back, within their hips, and not present with any pain at all. So a scan is not a diagnostic tool on its own. It needs to be considered having taken a good history, having assessed that area of pain. So just be very careful of how you understand scans. It's not the be-all and end-all. And more often than not, we don't really refer our clients for scans unless we really, really feel that there's something we're not picking up, because people tend to create an anxiety for themselves around what the scan is showing. And oftentimes, it's not relevant to what we're actually treating. We often hear the terms slipped disc and crumbling spine. I want to speak about slipped disc first, just to say that it's not possible for that soft cushion between your vertebrae, between the bones of your spine, to slip. Just like you can have a muscle injury or a tendon injury, you can have an injury of that cushiony disc, whereby the softer liquid in the middle makes its way through the harder wall of that disc, and it irritates the nerves that's just outside of that disc. But that is a self-limiting condition. It can heal on its own as that thicker wall of the outside of that disc heals. Where physiotherapy comes into play is we try to limit your pain or reduce your pain, even remove your pain, and try to prevent it happening again. And we tend to use exercise as well as advice to a limited extent within our professional boundaries on nutrition and supplements, or refer you if you need referral. Also be very careful of how you receive the term crumbling spine. We really working on the words we use to describe conditions, because what we really don't want is to create fear. We want you to know that your body is very resilient and it's highly unlikely that your spine is able to crumble. Pain in general does not necessarily mean tissue damage. You can have secondary pathology because of other factors. Pain is an experience generated by the brain in a response to perceived threat. So whether that threat is real or not, it doesn't necessarily mean you've injured the area. The threat could be worry about a loved one. It could be financial stress. It could be you did this movement and you're not sure if that movement was safe, and you may wonder if you did hurt yourself. Just wondering if you hurt yourself is a perceived threat that can generate pain. There are so many things that can add to your experience of pain. It does not mean tissue damage. So trust in your body and be wary that pain is a complex experience and that you don't have to immediately start kind of stressing or ruminating about it, because even in that you could make it worse. Rather just have it investigated. Oftentimes you'll have your fears eradicated and you won't really struggle much longer with that pain. And then although it may seem counterintuitive, pain requires movement. Lower back pain, it's very common. 80% of the population experiences lower back pain. And we tend to think that with lower back pain, we need to rest. And actually rest does more harm than good. You need gradual guided movement to help encourage healing, to help your body release its natural pain-killing hormones. But definitely movement is medicine. Those are the most common myths that I'd like to debunk at this point.
Courtney, you mentioned bad eating habits and having a certain lifestyle. And then, of course, you touched on back pain as a common ailment that people experience. So with so much having changed in our lives, whether it be over the last year or even as a species, as humans, in your experience, what are some of the other common ailments or injuries that people sustain on a daily or weekly or monthly basis due to lifestyle?
Typically, in the hospital setting, we would find ailments and injuries related to metabolic conditions such as hypertension, diabetes, high cholesterol, and then also to lung conditions because of lifestyle choices such as smoking, so COPD and asthma. Also because of environmental factors, possibly where you're working and the fumes you're exposed to and that kind of thing. So because of these medical conditions, we find that there are secondary injuries or conditions that it brings upon. Commonly, we'll see strokes, heart attacks, sepsis infection, amputations, and then difficulty clearing secretions produced by maybe COPD or something like that. And then in the outpatient setting, we tend to see more overuse type injuries. So if I can start by saying that your job needs to be acknowledged almost as the athletic event. You are the athlete, your job is the athletic event, and it needs to be trained for. So for example, if you find that you're working in a store and you find yourself lifting and carrying boxes and packing shelves, if you need to do that all day long, that is the athletic event and you need to be overly prepared for that. And that's where physical training comes into play, because it would bring upon repetitive movements that may result in overuse injuries if your body was not prepared for that. Then commonly we find neck pain, shoulder pain, and back pain because of desk jobs and maintaining a certain sitting position. You may not be moving through that position, but the certain muscles involved that's kind of been held in that position under the load of your body weight for an extended period of time can also present with a repetitive strain injury. So the common conditions in terms of lifestyle choices are either related to actual medical conditions causing secondary complications like a diabetic foot that results in amputation, or nerve-related injuries because of diabetes, or a stroke because of high blood pressure. That's very common. But then to a less extreme, pain is commonly experienced in the joints, in the knees, because of poor lifestyle choices in terms of lack of physical activity, poor diet, and very, very important, poor stress management. Stress plays a major, major role in how you experience your pain.
And in looking at stress, there's obviously different levels of stress that we experience as adults and then, of course, as children. So do you find that there's at all an overlap with adults and children having the same ailments or injuries? And is physical therapy the same for both?
Physiotherapy for adults and children actually look very, very different, because physiotherapy is based on achieving the physical goals of the client, getting them to their full potential for optimal quality of life, to be able to perform their daily activities freely and comfortably. That's very different for adults and children. So that's where physiotherapy mainly differs. There are certain conditions that are similar, especially when a condition is treated from childhood into adulthood. And I'll give some examples of that. But physiotherapy is actually very different. So if we can speak about children first and then compare it. Typically, children are referred to physiotherapy for developmental delay, so they're not reaching their physical milestones at a certain age, and that gets noticed and gets investigated, and then physiotherapy intervenes to help them reach their milestones. Typically, physiotherapy for children is very play-orientated because that's what they're doing at their age, and we want to stimulate them appropriately for their age. We also have certain congenital meaning they're born with a certain condition. Spina bifida is one. Fetal alcohol syndrome is an example of another. And sometimes cerebral palsy. Cerebral palsy means injury to the developing brain, so the young brain. But those conditions often present with physical deficit that needs ongoing physiotherapy. And those are examples of physiotherapy that then also get carried on into adulthood. And then you also get your traumatic injuries, either from sport or a car accident or that kind of thing, which could be very similar to adults too. And then you also get your chest or your medical conditions like asthma, which could be similar to adults, or lung disease. The main differences are, like I said, the approach. In adults, it's more likely going to be therapy that mimics the work environment, or if it were stay-at-home mom, for example, the activity she needs to do in the home, or even a stay-at-home dad. If it were a more elderly person that wants to be able to play with their grandkids, it would mimic the movements of being able to pick up that child, hold them close, swing them around. It really does depend on the goals of the client and what they want to achieve. Adults, although it shouldn't be this way, are less likely to play. Adults should be playing more too. But that's where the main differences lie. And also the maturity of the body at the time and the healing phases, or how quickly the body heals, how effectively the body heals. So it depends on the condition and then how the body responds to it. Children's bodies look obviously very different to adults' bodies. So their two healing phases, those kind of things make physiotherapy different between the two.
And so you spoke about our bodies adapting to our lifestyle and the work that we do. So speaking from personal experience, it's often human nature to simply adapt to aches and pains, for example. And sometimes we only get the professional help when our situation is really dire. So for example, we're flat on our backs, we've got lower back pain, and now we're in excruciating pain and we can't move. So in your experience, how have unaddressed ailments impacted your clients' lives? So for example, their personal lives, their career, their school life, their social life. How have you seen those areas of their lives change?
Yeah. So if I can start off by saying that the body is incredibly resilient and the body is able to adapt to changes. But when I say adapt to changes, I'm speaking about more anatomical changes. So maybe a slightly abnormal curvature of the spine, or a difference in the length between two legs. So those anatomical changes. But the body is less effective at adapting to ongoing stress and poor nutrition and a lack of movement. This is where the issues come in, or where it becomes problematic that you do not address ailments and you kind of leave it to a dire situation. Oftentimes, when you are experiencing pain, like I said, doesn't necessarily mean tissue damage, but it is a response to a perceived threat. So it does mean that something is going on and it's worth looking into. A major concern of not addressing ailments when it kind of rears its head and say, hey, pay attention to me, the onset of chronic pain. So the body actually then becomes desensitized at various levels. And this actually changes within the nervous system at the level of the periphery, so where the nerves enter the arms and the legs, at the level of the spinal cord, and within the brain. It will actually produce physiological changes that will then set off a cascade of ongoing pain in the absence of any damage or injury at all. And that's purely because of ongoing perceived threat, and the body adapts, and it adapts in a protective way, and it's slightly maladaptive. And the problem with chronic pain is that it affects you at different levels. So it'll affect your emotional and mental well-being. It may even affect your physiology, causing problems like irritable bowel syndrome. It affects you in different ways because your body is one system. And then that really has an effect on all those different spheres of your life: personal, career, school, social. So oftentimes people are experiencing ongoing pain, chronic pain, ongoing illness that they haven't addressed. They don't really feel like engaging with their loved ones. And then isolation sets in and that cascades problems. Or they don't feel like they will be able to access certain environments. They may not feel like going for a picnic in the park because they don't feel that they'll be able to sit down onto the grass successfully, be there comfortably, and stand up, possibly walk from the car to the park. So it becomes debilitating and possibly embarrassing. And they're just not willing to engage, and that results in isolation. On a personal level, sometimes people struggle to actually perform normal day-to-day hygiene, personal care tasks. Chronic pain of the shoulder, not being able to brush your hair, wash behind your back. Chronic pain of the hip and knee, not being able to get in and out of a car, or climb the one step before your front door so you kind of don't leave the house. That also leads into social. Put on your clothing, arm above head, pull your top up over your head and your neck, or reach forward because of chronic back pain and pull your pants up or pull your sock on. And then also in terms of their career or their work situation, if they are experiencing ongoing pain, which does have an effect on your mood and emotion, you may feel very demotivated. You may feel very distracted. You may be very uncomfortable sitting at the desk. So it definitely can play over into your career too. Okay, physical stress, children, their bodies tend to adapt really well. Then on a psychological level, pain could then affect them in a similar way to adults in the way they interact at school, wanting to go to school, not being able to engage in activities and feeling isolated. So I think that's where in children and in the school setup, unaddressing ailments may become problematic.
Courtney, you've mentioned movement a number of times and the importance of movement. And you're a big fan of physical training. As I mentioned at the beginning of the interview, you and your husband are avid CrossFit fans and you train quite often. And you're a fan specifically of strength training. How important is it for us to include that kind of movement and activity in our daily lives?
Thank you so much for asking this question. Yes, you will likely see me post a lot about weight and strength training in my social media. And it's mainly because I feel that it's under-advocated for and misunderstood. I must say that I definitely will advocate for or emphasize the importance of incorporating different types of training, including your aerobic endurance training, your mobility, stability, agility training alongside strength training. The reason why I advocate for strength training, like I said, is because I guess the endurance and the mobility training, such as running, cycling, our yoga, is already quite well advocated for. And there's a misunderstanding about strength training. There's this perception or stigma that strength training is for men and that it makes women look manly and it's not safe for elderly people. And that is so inaccurate and incorrect. And I have to do my best to undo those thought patterns. Strength training, first of all, if I can speak of the elderly population, obviously strength training needs to be applied appropriately. You need to be assessed. It depends on where you're at in terms of your strength. Strength training doesn't necessarily look like picking up a kettlebell or a barbell. It can be a TheraBand. It can be a 2 kg bag of rice. It just depends on the person themselves and where they are at. And then it progresses. But strength training has so many benefits. So if I'm thinking of the elderly population, prevented osteoporosis, you're really loading your muscles and your muscles are attached to your bones, which means that you load your bones. And in loading your bones, you're encouraging buildup of new bone tissue, bone mass. So that's how you're able to strengthen your bone mass and prevent conditions like osteoporosis. Your arthritis as well. I think that strength training is feared because of that pain that they're experiencing at the time. But actually having good stability or having muscles that are awake. If they are awake and doing what they're supposed to, they actually support the joints and relieve pressure off the joints. And that helps with your pain. And you just feel Like you can engage in more of life. You can do the things that you need to be able to do because you have the strength and the mobility to do it. You have that unloading of the joints and reduced pain. It also helps in preventing injury because you improve your body mechanics. Again, this is applicable to the sportsman, but it's also applicable to the elderly who becomes increasingly at risk of falling. You want good body mechanics. You want to have a good body awareness to prevent things that come about with aging. Oftentimes, my job requires me to be able to lift, transfer, move about people who are heavy, who struggle with paralysis. And this is where strength training is very important for me because it prepares me for that so that I don't injure myself during the athletic event, which is my job. And then also what I find very beneficial for strength training is that it helps reduce your stress hormones like your adrenaline and your cortisol and helps your body release your natural pain-killing and feel-good hormones, especially your endorphins. So it keeps you away from needing to take medication. And remember, medication has its place, but it also has its side effects. So we kind of encourage our body to do the best it can first. Then what I must emphasize as well, because maintaining good body weight and good physique is important to many. We do all naturally have an ego and want to feel good and look good. Weight training requires the use of so much energy. Every muscle fiber, every filament requires energy to both contract and relax. So you really do use up a lot of your calories and a lot of your energy for weight training. So it is beneficial. I think it's assumed that your aerobic type training, like your running and your cycling, that is what's necessary for weight loss. To a certain extent, yes, but sometimes actually weight training is more effective at achieving that. Weight training, it boosts your energy levels, and it really just improves your overall quality of life. I will emphasize that weight training does need to be guided by a professional if you don't know what you're doing. Even as a physio, need guidance just for somebody to look at my body and see what it's doing and looking at my body mechanics. And that's why if you're not sure of somewhere to start, CrossFit might be a good choice for you.
Yeah, Courtney, you've given us such great information through this interview. And as our conversation now draws to a close, is there any other physical health and wellness advice that you would like to leave with our audience?
If exercise is unfamiliar to you and you're kind of just starting, keep in mind and be encouraged that something is better than nothing. It is important that you engage in activity that's meaningful to you. Oftentimes, you're going to stick to it if you join in with a group of people that have a like-minded approach and a common goal, and that's going to hold you accountable. If you're new to it, it's probably not the best idea to kind of tackle it on your own. Get into a group, get into an activity you enjoyed. Think about your childhood and what you enjoyed doing as a child. You'll likely find that you still love it today. Tackle that type of sport or that type of movement. Then, having said something is better than nothing, once you're in a sustainable routine, you do need to apply more specifics for it to be most beneficial and to achieve your health goals. Not just weight loss. We're talking about cardiovascular fitness, so fitness of the heart and the blood system, reducing blood glucose levels in your body if you're diabetic, improving how efficiently your muscles use oxygen so that there's less of a demand on your respiratory systems. And in that case, it might be a good idea to access a physio or a biokineticist or a personal trainer. A physio, if you are experiencing disease, injury, or pain, if they're in the absence of any of that and you're just wanting to start your lifestyle or your fitness journey, then a biokineticist or a personal trainer. You can also access the World Health Organization exercise guidelines. You just Google it. It will come up. There's age-specific guidelines, and you can have a look at that first. I guess I'd like to end off by saying that health is not just physical health and fitness. Health incorporates spiritual health, mental health, and nutritional health. You are one system. You have to pay attention to all of those aspects because spiritual health, mental health, and nutritional health is all-encompassing and all-important in maintaining good overall health and a good quality of life.
I have no doubt that there'll be listeners who want to get in touch with you to discuss either their options in terms of physiotherapy or maybe just to get some more information about physiotherapy and taking care of their physical health and wellness, where are the different channels where they can reach you?
You can WhatsApp me, you can call me. So my WhatsApp and cell phone number is 067 926 8348. If you want to find some educational content that I may have posted, you can find me on Instagram at Courtney Ravell Physiotherapy. And on my Instagram profile, as well as my WhatsApp contact profile, you'll find a website link too if you want to check out my website. And then you're also welcome to email me at cravellphysiotherapy@gmail.com. And I'd be happy to receive any questions about physiotherapy or anyone who needs help, who needs to book an appointment or needs some guidance.
Wonderful, Courtney. Thank you so much for being our guest today and for sharing such great information. I've definitely learned a lot from our conversation, and I'm sure that our listeners and our audience have learned a lot too. You've given us a ton of valuable information about physical health and wellness, specifically the physiotherapy, and you've shown us exactly how it can benefit us. And I really look forward to having you as a guest again.
Thank you so much for having me. It's been an absolute pleasure.
We hope that you enjoyed today's podcast episode. Be sure to come back regularly for more great content that focuses on personal, career, entrepreneur, and business growth. Find out more about our coaching services and get in touch with our team by following the link in our post or visit dingscoconsulting.co.za.